Prior to my life as a physician, I was working on a doctorate in nutrition. I have a bachelor's and a master's degree in nutrition and completed my PhD coursework prior to starting medical school. So my background really began in nutrition. When I entered medical school, I was trained like most allopathic physicians that our job is to diagnose disease and to treat it with medication and surgery when necessary. And so I followed that model for the first few years of practice. I began to turn back towards my nutritional training and trying to help them understand nutrition as well as exercise physiology and activity as a means of helping them improve their health and reverse some of the chronic diseases that I was seeing on a regular basis. I tell my patients that we are one big biochemical reaction. Everything that's happening in our body is a biochemical reaction. And for biochemical reactions to occur, we need a solvent. And the solvent in our bodies is water. So there's no question that the most important thing that we can do is hydrate our bodies. When we treat chronic disease with medication and we don't really attack the root cause, which is oxidative stress, free radical damage, we're not really treating or curing the disease, we're managing the disease. We rely on oxidative stress to kill bacteria and viruses and fungi. But oxidative stress in excess, when we don't have the proper balance, when we have too much oxidation and not enough of its counterpart, which is reduction, then we get into this situation where we start to see degeneration occur in cells, in the tissues, and ultimately in the body. We get degeneration of the body, we get aging, and we get chronic disease. Oxidative stress is the mechanism by which all this happens. Anytime our body sees protein that it doesn't recognize, we have the susceptibility to cause an inflammatory reaction or an allergic reaction. I really do think there's a connection there with incompletely digested proteins through the typical American diet that we consume. We need to respect the fact that we have all these built-in mechanisms to help us fight disease, to maintain our health. But we need to support ourselves in that healing process by eating natural foods, by drinking the right type of water, by managing stress, by getting plenty of exercise and plenty of oxygen to our lungs. For those of you who are trying to optimize your health and trying to do everything you can to have good health, to maintain your health, preserve your health, my plea is just try the water.
In Japan, they have a saying, Mizu wo kaereba, jinsei ga kawaru. Translated, change your water, change your life. Do yourself and your family a favor. Ask for a free sample of Kangen Water. Try it and see for yourself.